Committee meeting to order at 12:33. Stand for the invocation. Father, thank you for today. Thank you for the way you provide for our government health services. We've got dedicated people that treat our people and have a servant spirit. We pray just your continued blessing on that, because we know how much that means to our citizens to stay healthy. And with your blessings, we pray that we continue to do so. Father, be with this time together as we review the health services and listen to these reports. And may we take this information and utilize it to the best of our ability in Jesus' name. Amen. I trust you've had time to look at the minutes. I would entertain a motion to approve. In a second. All those in favor? Any opposed? Point of order.
Roll call.
Gail's a troublemaker. You're supposed to have done it earlier, Gail. Okay, roll call.
Mike
Gail.
Dobbins.
Here.
Dora Patzkowski. Keith Austin. Danny Callison. Julia Coates. Sean Crittenden. Joe Deere. Rex Jordan. Johnny Kidwell. Darrell Legg. Wes Snowfire. Josh Sam. Mike Shambaugh. Melvina Shophouse. E.O. Smith. Candessa Teehee. Victoria Vasquez. You have a quorum.
Thank you, Gail. I assume we don't have to reapprove the minutes, right?
No.
Did it backwards?
I just need to know who did it.
Mr. George Vallier, please come before us. Thank you for coming, George.
There, is that better? You got my report in front of you, but in the last week, we administered 74 COVID vaccines, tested 674 individuals, 63 positives for a 9.35% positivity rate. That's for the last 7 days, for last week. Over the last few weeks, we had there at the hospital, we had a HIV testing day. We gave away HIV tests, promoted that there in the lobby. We are completing final touches on a conference training center out behind the main hospital by the warehouse. It should be, we should be able to start meeting in there just any day now. So that's a really exciting time for us. Our employee association over Halloween had our annual fall festival. We got back to our fall festival, and then they had a decorating contest inside. But the fall festival outside was for employees, kids, families, community members driving by, big time that afternoon. We were blessed with good weather that day, so it turned out good for all of it, for everybody. On the dental side, we in the report it said we hired a couple of dental assistants. We actually had one go through new employee orientation last week, so that's a total of 3. There's still 3 vacancies. When I asked about that, the 3 that we just brought on are all brand new grads, right out of school. So he said it would take a couple of months to get them up to speed. So we're making progress. We're pushing on that and meeting regularly to stay up with that and move forward and improve those numbers on dental access. Any questions?
Questions for George? Melvina?
On the dental, on the appointment, how do you, is that every day you could call for appointment, or are there certain days to call?
I understand you're supposed to be able to call any day.
Anytime?
Yes.
Okay, all right, thank you.
If you find out that's not the case, please let me know.
I know some are.
Yes.
Any others? George, you said the dental assistants came from a school. Do you know what school they came from?
I don't think these three came from the same place. We were meeting about that, and he had pointed out that they were all brand-new grads. So it was going to take him a couple of months to get them trained and out of the school mode.
Is that at IHS, is it required for your new dental assistants to have this formal training, or can they be trained on the job?
Well, they're going to be trained on the job. That's what I meant.
Okay, all right. Danny?
George, I want to, I've been one to question a lot, but the last month, I had a family member that used the emergency services through the Claremore Indian Hospital, and excellent treatment, excellent service, and, I want to give flowers where flowers are due, and I want to, your emergency room staff did a very good job for us, so thank you very much, sir.
Thank you. We're very proud of them. They work hard.
Keith?
George, I see the reports for October, and you have two 80 to 89-year-olds that tested positive for COVID that month, which one of them was my mother. And you guys handled her so well. You treat her like the cherished elder that our elders all deserve to be treated. And she was did not get truly ill, thank goodness. But I always appreciate your staff up there for that. She was treated like the cherished elder that she is, and I thank your staff for that.
Oh, you're welcome. Thank you. I didn't realize she was in my numbers this month.
Well, she's just one of your cherished elders.
Okay, George, thank you for coming, appreciate it.
Thank you.
Thank you for your report. Merry Christmas. Dr. Stephen Jones, here with Health Cherokee Nation Health Services.
Good afternoon. Merry Christmas. All right. Your report is in your packet. I'm going to go over some highlights of some of the other things that I'd like to cover real quickly, and then we can hopefully get to some questions. Just an update on the construction projects. Everything is moving along on schedule. Looks like they're all going to be wrapping up this month, and maybe a few of them that hang around the first couple of weeks of January, but our goal was to have all of them wrapped up by the end of this year, by the end of this month. We are in the process of hiring and training some of the new services, like at Nowata. We're going to have dental services there for the first time, so we're hiring new staff and getting them all trained up on sterilization and things like that need to be done before we open up. So everything seems to be moving along as we had anticipated. Our patient engagement and Navigator program that we had talked about in the past for at large is moving along. We've got those jobs advertised, and we are preparing for the training process for that, since that'll be a new service when we get those folks online. So that one's moving along and getting closer to being ready to go. We've initiated a work group, or put together a work group that's going to be meeting with some of Georgia's folks soon for the legislation that you guys, or the resolution that you passed, to start that work group to see how we can improve some of those things with the communication between Claremore and us, and how that contract health and some of those things work. So that'll be kicking off pretty quickly. So just give you an update on some of those things that you guys have been interested in. We've recently, I want to give a shout out to HR. They have, I know I watched Rules this morning. She didn't, the executive director Samantha did not mention it, so I told her, I texted her and said, I'm going to mention it in my report. I won't steal your thunder, but there's going to be some new processes rolled out in January. The last few weeks, we've been meeting with all of our supervisors and directors to get the training done before we roll out those new processes on some compensation changes, and I think it's going to be a really positive thing for health services. I think our vacancies, where we've had a little trouble hiring people at some of our clinics, it's going to impact that greatly. So I'm anxious for that to kick in, and our anticipated rollout is the first week of January, so I'll let her tell more about that when she comes forward. I don't want to steal her thunder because I don't think it's official yet, but I will give her a shout out. Her staff has been doing fantastic in getting that training done, so we appreciate that very much. We are focused right now on getting our surgery clinic, outpatient surgery clinic, up and running, fully functional. We've been kind of slowly rolling that out with some soft opening things and kicking that off to find out what things we need to do because we have not had a solely dedicated outpatient surgery center. So we are getting that running, and we're very close to having that thing running at a higher capacity. So you may hear more about that to come. I want to mention the RSV clinic. I know it caught a lot of attention when we first opened that up. I talked about it briefly last time we were here. I just want to reiterate that is a temporary service that we put in place, and we've asked our folks to basically do double time to open that up, to have that fast track for kids to go through. I understand last week we were averaging somewhere between 35 and 40 kids a day. So we're still in the midst of that, and we're still going to continue it until those numbers drop down to where our urgent care can handle them individually. Right now, it's too much to add on to our urgent care, so some of our pediatricians, some of our staff, we've pulled them out of the clinic and put them into that scenario. We still have same days at the clinics where we have pediatric openings, so we still want patients to go to their clinic if they can, and get those same days, but we do have that fast track available. And that's open from 8 to 8, Monday through Friday, and noon to 5 on the weekends and holidays. So it is staffed, but I just want to make sure everybody understands it's not a permanent change. It's to meet a need until this need starts to dissipate a little bit, and then we'll get back to getting them back in the clinics where they belong. So. But we are trying to meet that need and keep those children from sitting and waiting at urgent care or in the ER. Going back to some of the good things that happened this last month, we did receive 2 awards. There'll be some more information coming out on that from National Directors Awards for our vaccine response and our COVID response over the last few years. So. We're going to be doing some special things to recognize that, and that'll be coming out. Again, I don't want to get the cart ahead of the horse, but we're working on some things to reward our staff and recognize our staff for all the hard work they did during those times. So the last thing I want to mention is we did have our first annual Christmas tree lighting at CNOC this last week, and we were able to get a big old Christmas tree up there, and Chief came by, and we had employees. It was just for employees this first time. We plan on expanding that and having trees at all the clinics, and maybe next year we'll have a simultaneous lighting across the reservation for our clinics. So just another way of engaging our employees. Santa Claus made a visit, so a lot of the employees brought their kids, and they had a great time. So it's just a little thing that we're trying to bring in more togetherness from all of our clinics and include everybody. So with that, I'll turn it over to back to the chair, and if you guys have any questions, be glad to answer them.
Was that award you mentioned, was that the award from IHS for our performance during the pandemic, Cherokee Nation Health Services?
And yes, and there were 2, one for the COVID response team, and then there was one for our vaccine efforts.
I don't think they handed too many of those out, did they?
Not too many of them. So
Yeah.
we went up and accepted that on behalf of the health services, and like I said, we've got some plans next month to roll out to recognize and acknowledge all the hard work that went on. But I don't want to speak too much onto that, and I'll let that come when we're ready to announce it.
Yeah, that's great recognition. Julia?
Hi, Dr. Jones. I had some questions about the patient navigator. So as I'm understanding it, you're in the application review process right now, but no offers have yet been made to anyone, or?
I don't know exactly where we're at. I know we've advertised those positions, and I think one of them has closed. I think 2 of them are still open, if I understand that correctly.
Okay.
Once the panel is formulated, they'll come back to us for interviews. So We haven't selected anybody, we haven't got anybody hired yet, but we're in that process, so we're getting very close.
Okay, and then after that, there will be a training period of a few weeks, or what do you anticipate on that? So-
It really depends on how familiar they are with our processes on the people that get hired. Our hope is not only to be training them about what we do, but to also train them on resources in each of the different areas of IHS, so that if there is someone that's in let's say, in a different area, then we know who the contact people are and how we can get resources to those folks, so, and what clinics are available. So it's a little bit broader training than just on health services alone, because not everything's available through us, but there may be resources depending on where they geographically live.
Okay, so do you have any kind of a time frame about when this might actually be available for citizens to utilize? Would February be too soon, March? What, do you have any kind of an estimate?
I don't have the exact deadline, but I know that we're working as quickly as we can, because I know the next step, once we get people online, is to start putting together a 1-800 number. We're going to have a number that's specifically dedicated to that. We're also hoping to have an email address that's specifically dedicated, and I don't control any of those things, so once we get those things in line, then we'll be able to make that press release and announcement. I know that we're working as fast as we can to get there and get it open, so sooner than later, I will tell you that. I mean, I'm hoping that by the end of January and February, somewhere in that range, we're ready to go, but I don't know what obstacles we're going to run into with IT issues. We'll just have to wait and see.
Okay,
Yeah.
I've got people who are anxiously awaiting its opening date,
Yeah.
so.
And
anyway.
we realize that, you know, it's going to, the intent is to have it for at-large, but anything that we open up, you can't limit who's going to call that number. So we want to make sure we have our people trained to get people where they need to be for those resources. So it's going to be overwhelming in the beginning, I have a feeling. So we want to make sure that they're ready for it.
Okay,
Yeah.
thank you very much. Can I speak with you for a moment
Sure.
after this as well? Thank you.
Absolutely.
All right. Thanks.
So, Dr. Jones, that'll be available to the reservation citizens as well, or just at-large citizens?
Well, the intent is for it to be available to at-large, because for reservation, we have patient advocates currently now.
Okay.
But like I'm saying, and once we make that announcement, there's no way we can limit it, and we'll try to have people that are located on the reservation, reassigned or passed off to our patient advocates. But this is going to be, the intent of this is to have something for at-large citizens to be able to reach into our system and help find resources.
I guess that's my fault, because I've been trying to be one of these patient advocates. It's been a very weak effort.
Well, I think
So
all of you are.
Yeah. But any other questions for Dr. Jones? Candace?
Yeah, Dr. Jones, I also would like to speak with you for a bit after this meeting's concluded about another matter. But I was, in reviewing the reports, we get a lot of really great information, and but I recently had a constituent ask if we have ever requested like complaint numbers. And I know that's not something that has typically been included in the report before. But I kind of wanted to just inquire with you on what you might think about potentially including those numbers in our monthly reports, or if you feel there may be a more productive way for us to review anything like that at Tribal Council.
So the way if someone has a concern, they're brought to the local level, to either a patient advocate, and then a form is filled out. And if things can be handled at the local level, no matter what it is, it can be something as small as, people were parked in the handicap parking that shouldn't be parked in handicap parking. I mean, there's a lot of things, or someone pulls up and drops someone off and parks their car in the drive-thru. I mean, that happens
Right.
all the time. And then they go in and leave their car parked. Things like that are resolved at the local level, they keep locally. We don't necessarily have them escalate those up.
Right.
Now, if something can't be handled at the local level, then there's a process through our governance structure that goes to a grievance committee. And a grievance committee is made up, our compliance officer is in charge of that, and it's made up depending on what the level of the grievance is. If it's a medical grievance, then it's going to be they're going to put a group together that's made up of medical directors and medical personnel. If it's a clerical issue, then it's, if it's something where someone's paperwork got put in the wrong chart, whatever it is, it has a work group that is brought up, or a committee that's put together specifically for that concern. And then that committee has a certain number of days that they have to get resolution on it. So that's the part that I see. That's the part that's raised to the higher level. Things that happen at the local level, I don't necessarily see those because they get handled at a local level. So we do track it through some what we call safe qual, if it's something that's a patient safety issue or if it's something of that nature, so that we make sure if there's a trend happening that we are addressing that trend. But so it's kind of hard to quantify what it is that we can share and what we can't share.
Okay, but in terms of potentially, like, just aggregate numbers, would that be a potential possibility?
I could do that probably with the grievance. I'd check with compliance and legal to make sure it's something we can share.
Okay.
But
Okay.
as far as the stuff that happens at the local level, we really keep that at the local level, and it's
Okay.
it's not elevated up, if that makes sense.
Yeah,
Yeah.
that makes total sense.
Yeah.
And, again, it was something that one of my constituents brought forward as a concern, just, I think, asking for a second layer of notifications, I guess, sort of, for those of us on tribal council. And, I understand, when we're dealing with thousands of patient visits, and some of those patients who are in crisis, and maybe they're being seen on one of their worst days.
Yeah.
I understand that things can be extremely emotional and highly stressful, and those traumatic experiences are something that the staff has as well,
Right.
because they care for those patients very, very deeply. And so I appreciate your thoughtful response there, and I'll touch base with you again after the
Okay.
meeting.
Sounds good.
Thank you.
Dr. Jones, I know, as working as an advocate, that's part of a monthly report, our complaints went into, the director of that site.
Of that clinic, right.
Uh-huh.
Yeah.
Thank you.
Hey, Dr. Jones, without getting into specifics, do you remember the conversation we had the other day about the lady who was pregnant?
Yes.
Did anybody ever get a hold of them? Do you know? I know they tried and they didn't. Did they call back? Do you know?
I don't know. I followed up that day, and our advocates tried to reach out, but there was no return they left a message, and I wasn't notified today, but as of Friday, they had not returned the message.
Did you check into that complaint?
I turned it over to those that handle that type of stuff, because if it does elevate to a grievance, then I have to get involved. But I try to stay out of the specifics of them unless it gets elevated to a grievance. So it was given back to the place where it occurred and to those advocates to try to resolve the issue.
Okay. I will try to get a hold of that person and have them get a hold of them.
Yep, that'd be fine.
All right, thank you.
Any other questions for Dr. Jones? Dr. Jones, the outpatient surgery endeavor, when it's up and running, will those procedures be done at CNOC or Hastings?
At CNOC.
So it'll be in the outpatient clinic?
Yeah, we're trying to get the outpatient surgeries to be done there, so we can open up the inpatient surgeries for more of the things that you need to be admitted for after a surgery and kept in the hospital for recovery. So we're slowly getting those things off of the surgical suites at Hastings and moving them over to the outpatient center.
So are we doing outpatient surgeries right now?
We are. We're doing endoscopy and dental surgeries right now.
Okay, all right. Okay, Dr. Jones, thank you.
Okay.
Up next, Miss Lisa Pivek from Cherokee Nation Public Health. Thank you, Lisa.
Good afternoon. It's good to see all of you, and Merry Christmas. I've seen some of your bright faces out at some parades, and it's a great time of the year. So hopefully this weather will keep mild for a little while. You have your report, our report in front of you. I'm happy to answer any questions. I don't have anything specific in the report to talk about today, other than we're just revamping a lot of our activities for the new year, looking at a lot of our services out in the community. And if you read through the report, you see that every community has a little bit of a different feel in it, and we do a little bit of different stuff in every place, but trying to put together one core set of programs that we offer at every community and each community. Still working with CDC and still working on getting our youth risk behavioral survey information out to look at we've been doing it since 2010 and looking at what's happened from 2010 through 2021, and we'll be doing it again in 23. So we've got quite a bit of information to put together and get that through the approval processes. Otherwise, I don't have anything else for you today, but I'm sure happy to answer any questions you might have.
Hey, Lisa, is your group the ones that's over Marcoma?
Yes, we are.
I had a request today to see if it's a rural fire department and they're building a building for workout equipment and want to know if y'all had any surplus workout stuff that y'all could donate.
We often do. I will check with the director and see about that. But we also offer some consultation too. Sometimes our trainers can help them say, this is be the best equipment for you if you want to. So.
Okay,
Yeah.
thank you.
Mm-hmm.
I don't know if you're the right person, but I'm going to take a stab at it. Some constituents said there's a shortage in diabetic medicine.
That would not be me, but.
Who would be the right person?
That would be probably our pharmacy or Dr. Jones. I think he might have taken off. I think he's in someone else's office. But I have heard that on the news as well, but I
Okay.
don't know, I don't have any information on it, and not any specifically to us either. So Dr.
Okay.
Jones would probably be the best place to start.
Okay, I'll talk to him after this and
Okay.
see what their plan is if they run into situations like that.
Like treatment medications.
Yeah, what do they do in
yeah.
the intermittent time, so.
Yeah.
All right, thank you.
Mhm.
That's a good question, Joe. Of course, a lot of our population has to deal with diabetes, and just crunching numbers, how much money we invest in diabetic meds, staggering. And it keeps going up, up, up. So it's a good question. Hopefully Dr. Jones can enlighten us before he leaves. Daryl? No? Oh, I'm sorry, Josh.
Thank you, Chair. I just wanted to commend the community health worker group. They've been doing a lot of good work over there for some of our citizens that we may not hear about or may not be able to contact us, but big help there, especially in Adair County. I just wanted to commend them.
All right, I'll pass that on to them. I did notice that they saw somewhere close to 500 people this last month and made connections, and a lot of those first language speakers, about half of them. So, yeah, thank you for that.
We have a lot of different businesses that we venture into. Why not pharmaceuticals? Why couldn't we open up a lab and order the diabetic medicine, produce it ourselves, and get it at a much cheaper rate? Because the pharmacies and the pharmaceutical companies are marking it up 700% anyway. I don't think that'd be too outlandish if we could maybe figure out a way for us to. I know, Lisa, I'm sorry, I'm in your time.
That's okay.
But you just got me thinking of. We have a good healthcare system. Why wouldn't we look into maybe producing some of our own pharmaceuticals, that, especially diabetic insulin and stuff like that? So I'll just leave that there.
Yeah, it'd be, boy, if we could pull it off, that'd be great, but I'm sure we just can't shut up shop on the side of the highway and start producing insulin. Yeah. I mean, we have to jump through, we have to jump through a few hoops to get into the insulin, but it's a worthy thing to look into, Daryl. Thank you. Any other questions might recognize Lisa as well. Lisa, due to her experience and expertise, is very active even on the national stage. And recently, if you look on page 1 of your public health report, was elected to the board of directors representing tribal public health departments. Just kind of tell us what that means to you and to the tribe, Lisa, with you in that national position.
And it's a big step for tribal public health. The National Association of County and City Health Officials serves 3,000 local health departments across the country and has recently ventured into making sure that they have tribal representation on their board of directors. And so in that position, I do a great deal of advocacy. I'm on the governance committee, so we work on the governance for the actual board. They do lots of activities across the nation. They're actually really active in the press as well. You may see them a lot. CDC reaches out to them a lot. CNN reaches out to them a lot, and they provide expertise and advocacy on all things public health. So it's good to have tribal public health represented. It's provided an opportunity to get more acquainted with the local health department directors here in Oklahoma. The one for Tulsa and Oklahoma City County are both, those are not state affiliated, those are local health departments, and they are both very interested in involving tribal public health in their work. And so we've been working together with both of those. So.
We appreciate you, Lisa, representing us on the national stage. I mean, these organizations.
Thank you.
Using your experience and your expertise.
Thank you.
Any other questions before we let Lisa go? Yeah, Merry Christmas, Lisa.
Merry Christmas to all of you, too.
Thank you, Lisa.
Mm-hmm. It's a pleasure.
He is? Is taller at him? And the question again was, can we get in the business of making insulin, I guess? Okay, all right. All right, I see no old business, no new business. Are there any announcements? Our next meeting is tentatively scheduled for Tuesday, January 17th at 12:30. We need one more motion and a second. All those in favor of adjournment? Any opposed? Meeting is adjourned.